Well, the state of Tennessee is among the least healthy in the country. It ranks 46th in the nation for adult obesity and 41st for infant mortality. State leaders say chronic diseases cost Tennessee more than $5 billion every year.
10 News reporter Mark Salinger shows us the troubling statistics and what's being done to fix the problems. Mark?
Robin and Beth, it all comes down to eating healthier, exercising more, and cutting out that tobacco. If Tennesseans do that, health leaders say the state can move in the right direction.
The trend line for health in the state over the last 20 years really has been not in a good direction.
When it comes to health, Tennessee has a long way to go.
We've seen the rates of obesity continue to climb.
Compared to the national average, Tennessee has a higher rate of people in poor health, people who are overweight, and people who have arthritis, depression, and diabetes. It ranks as one of the 10 least healthy states in the nation. In 2013, Governor Haslam started the Governor's Foundation for Health and Wellness to help turn the statistics around.
It has a huge economic impact.
Tuesday, leaders in Knoxville gathered for a roundtable discussion on the state of the state's health. Estimates showed chronic diseases cost the state more than $5 billion every year.
The state today is spending almost a third of every dollar it spends, about 32 cents of every dollar, on health care.
New numbers released this week by the Tennessee Department of Health show 1,776 people died in 2017 from suspected drug overdoses, more than any other year.
People who are physically active, eating a good diet, generally in good health, are much less susceptible to addiction.
While the need is great to fix the problem now, it will likely take years before Tennessee sees any improvements.
What we want to measure every week, every month, every year is incremental improvement. More people being physically active, more people eating better, and fewer people using tobacco.
And Knox County and Blount County are ranked among the state's healthiest counties, while Union County and Granger County are among the least healthy. Robin?
All right, Mark, thank you.